Opioid misuse and overdoses are a serious public health crisis across Washington state and nationwide. From 2019 to 2021, the annual number of opioid drug overdose deaths in the state nearly doubled. That includes both prescribed and illicit opioids like fentanyl and heroin. Real information and education about opioids are crucial. That's why Washington State University faculty and staff, including Nicole Rodin at the College of Pharmacy and Pharmaceutical Sciences, team up with colleagues across Washington to get accurate and useful facts to people. Welcome to the Washington State Magazine podcast. We bring you stories of WSU research, outreach, alumni, and more. I'm Larry Clark, editor of the magazine. Rodin talked with me about the scope of the opioid epidemic, effective education, reducing stigma, and how we can all lend our support.
My name is Dr. Nicole Rodin. I'm Mrs. Training, and I am currently an assistant professor within the pharmacotherapy department at Washington State University College of Pharmacy. So I specialize in substance use disorders.
Can you tell me how big is the substance use and addiction problem, maybe especially with opioids?
Yeah, it's pretty massive. And I think 2017, the HHS actually declared it a public health emergency because of the opioid epidemic. So this is a problem we've seen for decades now, and it's only gotten worse since we've seen illicitly manufactured fentanyl come on the scene a couple years ago, unfortunately.
Yeah, we see it in the news a lot. We hear a lot of stories, and I think it's touched almost everybody that I know, in some way. I understand that you're part of a group that's involved with outreach and education on drugs, substance use. Can you tell me a little bit about that?
Yeah, so I'm part of two groups at WSU. One is the Apple Lab, or the Analytics and Psychopharmacology Lab, kind of a mouthful, and they're doing a lot of work for new and novel treatments of substance use disorder. And then I also work with another interdisciplinary group that focuses on outreach. So we kind of see what's happening in science and that evidence-based practice, and we try and translate that into everyday work in our community. So really turning science into practice. And so with that group, we do a lot of community presentations and harm reduction strategies as well.
Well, it's exciting work. Is there an area that you concentrate on? Is it particular communities?
We try to focus on a vast majority, but for the group now, it's really focused on rural communities. So it's the Rural Opioid Technical Assistance Collaborative. And so we try to reach communities that may not otherwise have access to some of this information.
Yeah, and I've read that fentanyl in particular and other substance use has really hit rural communities hard and maybe harder proportionally. Is that the case? And
Yeah, it's interesting because a lot of the news stories come out of big cities because it seems to be happening more frequently, but there's just more people for it to kind of happen to. And unfortunately, in rural communities, we see a different fallout. So because they are more rural, it's harder to get emergency services to emergency situations. It's harder to get those reversal agents on the scene if they're not already there. And sometimes there can be this safety blanket of knowing everybody around you, kind of thinking that mentality of it won't happen to me. So trying to really provide that education on what to look for and what the case might be if it does happen to you.
are there some challenges or problems that are specific to rural communities that make it hard to get help there?
Yeah, honestly, just the distance. I think it's hard to find access to services if you realize there is a problem, or if you want to even just know more about the problem. Sometimes it can be difficult to reach out in a non stigmatizing way in those rural communities. So, really trying to find that neutral third party, or even a physician or treatment services once that becomes a need.
So, how do you and the others involved with the outreach program overcome some of those barriers and get the information where it's needed?
Yeah, I think we've really capitalized on the use of Zoom and other webinar type technologies since COVID. And so I record a lot of on demand trainings. And so my theory has always been, or my motto has always been, informed consumers are always better, right? So we know the problem's out there. We know that just saying no doesn't work. But if people can understand what these drugs do in the body, if they can recognize some of these signs and symptoms of an emergency situation, and if they know the benefits to some of these harm reduction strategies and actually understand it, then we have a better chance of making a difference and moving the needle in the right direction. So in using that webinar type technology, we're hoping to get more information out to more people in a much more sustainable way.
That's great. And what are some of those harm reduction methods and some of the things that have been found to be effective in helping people?
Yeah, so in describing harm reduction methods, we look a lot at reversal agents. So for opioids specifically, things like heroin or fentanyl, having everyone keep Narcan on them, especially if you're in a rural place that it might be more difficult to get emergency services on site. Um, I'm a firm believer everyone should carry Narcan. I keep it in my house, keep it in my purse, it's in my desk at work, just in case, because you never know, right? Just like any other emergency medication, like an EpiPen, you hope and pray you never have to use it, but when the time comes, you're really glad you have it when you need it.
Yeah, and they certainly seem to be a lot more accessible now. Are there some barriers to, say, getting Narcan out to people in rural areas or just in general?
I would say probably the biggest barrier is stigmatization. Washington State in general does a great job of providing access. There's a lot of programs through the Department of Health, through local nonprofits that provide Narcan shipped directly to you, but you have to ask for it, right? And to ask for it, you kind of have to see a need for it. And so trying to destigmatize what this reversal agent is, like I said, you hope you never have to use it, but just in case you do, having it on hand is super helpful. So, convincing someone that it doesn't cause a drug addiction or that it doesn't let people continue using substances or what other misconceptions might be can be a little bit more of a challenge sometimes.
What's been the response to some of your outreach and education efforts? Do you have any stories of people who have been impacted?
Yeah, we've had a really positive response. The last webinar I did with a colleague over at the University of Washington, we co-presented on fentanyl and xylazine, and just giving information on what it is. She was a provider that primarily focused on treating adolescents with substance use disorders, and so we kind of tag teamed it, and we had over 900 people register for the webinar, and so we saw a really big reach, and over 5 people actually show up to the webinar, which is huge too. So, some of the questions that came out of that really reinforced what we're doing and was a little motivating too to continue to provide this information because we got really good questions and we got to answer them in real time, and I think that was really promising.
Well, it's great, that people can interact, and ask the questions they might have. And speaking of questions, can you tell listeners a little bit what's xylazine? Is that what it's called?
Yeah. Xylazine, unfortunately, is an additive we've been seeing in other illicit substances, primarily with illicitly manufactured fentanyl. It was originally a vet medication. It tried to go through FDA approval as a blood pressure medication for humans, but because of safety concerns, it never made it through. Instead, it became a really good vet anesthetic, typically for bigger animals like horses. And we saw it a while ago, I want to say in like 2008 in Philadelphia, being added to the heroin, and it really kind of prolonged the effects of it, but it also really increased the respiratory depression. So you kind of saw this spike in overdoses because of it. And then it started causing a lot of skin wounds. So if you've ever heard of like zombie heroin or zombie trank, that's what it was referring to. And so we started to see an uptick of that. So it was declared an emerging threat by the DEA recently. And it jumped from being almost impossible to find to being in almost 7% of the drug supply. So that's something we're keeping an eye on and making sure people are at least aware of.
So, you were talking about the education and it sounds really great. I know there's a lot of misinformation out there. And how do you combat misinformation, in particular what people might hear on TikTok or other social media that's really just not good when it comes to drug use?
Yeah, that's a tough one because it's just so pervasive. And the way that algorithms are kind of tailored to what you're wanting to see, it kind of creates this echo chamber, right? So once you hear misinformation that you are engaged with, you kind of hear it over and over again. At least my approach and our approach, as I work with some of these groups, has just been really transparent communication, really digestible and understandable. Because with especially this generation of younger students or kids, they've always had information in their pocket. And so when we had this previous generation that was maybe a little bit more patriarchal in their approach, right? Do as I say, not as I do. Listen to the words, right? Under my roof, my rules. That kind of approach just doesn't really work anymore because as educators, we get fact checked all the time, right? So we want to be clear and we want to state the risks that are happening, but we also want to be transparent in what these drugs are doing and why people are using them, right? I mean, you can get high, it can feel good, but it's at the cost of some of these risks like overdose or addiction and what that fallout might become. So really being a trusted source that can be verified in a way that people understand what you're saying, I think is one approach we're taking and hopefully it's working.
So, why is it important for WSU and for you personally to do this kind of work, this education and outreach to communities?
I think you hit the nail on the head when you introduced this topic of just everyone has been affected by this. It's pretty rare to find someone who has not been personally affected by some type of drug addiction or the opioid crisis specifically. I saw this firsthand with a few of my friends in high school. I continue to see it to this day with family members that are addicted to different substances. And I think we see it pretty prevalently within our community, specifically within Spokane. So it is really pervasive in my life personally. And so I always kind of had this idea that I wanted to help it and that I wanted to make a difference wherever I could. And I've been fortunate with WSU to find a group of clinicians and researchers that had that same mission and goal in mind, and have been really lucky to help forward their mission on and kind of contribute in any way I can.
Yeah, I hear that. I know I personally have known people that have suffered from addiction and even overdose. How did you end up working in pharmacy? What drew you to this field?
Honestly, it was very serendipitous. When I was in high school, I had to do a month-long internship in order to graduate, and my friend said, "My mom's a pharmacist at this hospital. Just do it with her. It'll be fun." And I was like, "Okay, easy enough." And so that kind of sparked my interest in it. And then when I got into pharmacy school, I had a fabulous mentor who did a lot of outreach in substance use disorder, and I kind of joined her student group and I think she cultivated not only my passion for engaging in this space, but also my passion for just teaching in general. The fulfillment, I guess, that you have when you share your knowledge and you hopefully make a difference with it.
What are a few ways that people like me or other listeners can help out?
Yeah, that's a tough question because it's such a systemic problem. I always encourage people to really understand how addiction works and specifically how treatment for addiction works. We don't treat it the same like other health conditions, which can really create a barrier to people receiving treatment for it. So, because it's seen as something extra or as some type of moral failing, it's not usually included in your health insurance benefits. It is very separate and it's usually very religion based, which can be a very good thing for certain people. For others, it can be a really big barrier to actually engaging in some of those services. So I always encourage people to advocate for the coverage of these services under everyday health insurance, and to know what policies are going into effect once we have our legislative cycles every year. Sometimes things get snuck in there that make it really difficult for people to treat substance use disorders or to educate on them as well. Or there's something that doesn't get passed that could really benefit the world of substance use disorders and the engagement of that patient population. But it's hard to identify what those are, and it's hard to understand it. So, kind of takes a little bit of work, or finding a group that is doing some of that work to better understand what we're voting for and putting in place.
Oh, that's really good advice. Is there anything else that you think listeners should know about your work or about substance use generally?
Yeah, I would just reinforce over and over again that it's not a moral failing. What might start as a choice, just like many other chronic diseases, does end up a disease, a chronic condition, and it's okay to ask for help. It is okay to not have to go through it alone. It's also okay to not have to support someone alone. So if you are experiencing a family member, a friend, a loved one, or you yourself are experiencing substance use issues, kind of seeking out that peer support can be a huge, huge benefit to recovery, success, mental health, all of the above. Specifically for family and friend caregivers, if you've never been to an Al Anon group, you can find them online. They're all over the state, even in rural populations, or something like it. It can be a really useful tool to kind of get through some of the toughest spots of being a loved one to someone who is suffering through a substance use disorder.
Well, thank you. That's really helpful, and thank you for all the work that you do and the rest of the group.
Yeah, for sure.
Thanks for listening. You could find links to resources on opioid use and overdose prevention, magazine stories, and more in the show notes. If you want to hear more WSU stories about interesting alums, campus life, and research, please subscribe on your favorite podcast directory. And please rate the podcast and spread the word. If you have an idea for an episode, let us know at magazine.wsu.edu/contact. This episode was produced by me, Larry Clark. Our music is by WSU Emeritus Music Professor and Composer Greg Yazanitsky.